I'm going to knock on the door, introduce myself. Hello, my name is Morgan. I'm going to be your nurse today. The first thing I'm going to do is identify the patient with two identifiers. I'm going to ask the patient their name, birthday, and then I would check the patient's name and birthday with their ID tag. After verifying the patient, I'm going to check the patient's order as given by the provider. And when I check the order by the provider with the name of the patient and the birthday, I know that I have the right patient. So, okay. Ms. Jones, what we're going to be doing today is doing some pericare and doing a catheter. So before we get started, I just want to know, how do you feel today? Can you rate any pain that you might have? Patient has no pain. If they did, I would check on pain medication and return. I'm going to ask the patient if they have any allergies to latex or medical supplies. The patient does not, so I'm going to carry on with the procedure. So I'm going to do hand hygiene.
And now you want to put on sterile gloves.
Going to put on clean gloves.
Or use my sterile gloves.
I'm going to pull the privacy curtain, and I'm going to raise the patient to a working level, waist level. All right, I'm going to get the pericare bucket. I'm going to get the overbed table to a working level, which is waist level. And now I'm going to do pericare, so I'm going to ask the patient if it's okay if I expose them. May I expose you now? They say it's okay.
Let me show you too with this bag. Can you set it up?
Yeah.
Put a lid on it. That way when you come back, you can come and go underneath it and get rid of it in case something falls on top of it dirty. So, okay?
I'm going to lower the patient's legs a little bit.
Take a moment, reset everything up.
You got any like?
I'm going to
Yes, I'll get you.
move your legs a little bit, sir.
And whenever you get ready to put your sterile gloves on, get rid of stuff that you don't need on your table.
Put a towel down
Okay.
for moisture that may get on the
And I'll let
patient's
one of your
head.
classmates video you, so maybe you won't be done this as well.
And now I'm going to clean the meatus of the penis. I'm going to make a mitt on my hand.
And Justin, you're not allergic to that latex, are you?
And I'm going to use soapy water.
He's gonna get everything set up.
I'm going to retract the foreskin if there is one. I'm going to go around the meatus in a circular motion. Once, use a different part of the rag. Twice, use a different part of the rag. 3 times. I'm going to rinse the soap off now with just water. So clean rag, just water now. I'm going to make a mitt. I'm going to rinse once, use a different part of the rag, rinse twice, use a different part of the rag, rinse 3 times. I'm going to pat any moisture off of the meatus area. And pericare is finished. All right, I'm going to discard these gloves. I'm going to perform hand hygiene. And now I'm ready to open my catheter kit and set up my sterile field. before opening the contents of the catheter kit, I would check for expiration date or a damaged package. If the package was damaged or the expiration date was overdue, then I would not use it. This Foley kit appears to be good. It's not damaged, and the expiration date is good. So perform hand hygiene, and I'm going to create the sterile field by
Yeah.
opening my kit.
So, okay, what you wanna do is walk in, ask the patient, that you're gonna get a wound change dressing today, and like verify the order and make sure that the patient's not allergic to anything. And
Okay,
verify
I'm
the
going to
patient's
get out my sterile gloves.
date of birth. You can check it on, ask them, and make sure it's right on the first hand on the system. And then what you wanna do is raise the bed up to about waist level. Raise it about waist level and stuff. And what you wanna do is put on wash your hair and put on your third clothes. And just like repeat things.
I'm going to get under the cuff of the second glove. And now I have sterile gloves. I'm going to interlock my fingers, keep the gloves away from my body, and not drop them below my waist. Okay, now I'm going to prepare my drapes. So I'm going to not use this first drape. And prepare the blue drape, only touching the shiny side. I'm going to put the shiny side down and not touch the patient's legs. All right, now I'm going to put on the fenestrated drape.
And now you want to take off the dressing. You want to put your hand right here. So
I'm holding it. I'm not going to cross the sterile field.
Pull it off while touching the skin without, touching the wound. Pull it off slowly. Then before you go to
Not touching the 1-inch border around the sterile field. Okay, now I'm going to prepare my kit. I'm going to use the hydrogen peroxide, not the iodine. I'm going to break my cotton balls up a little bit here. Open the peroxide. Saturate the cleaning cotton balls. Done with that. I'm going to get the lubricant. Open it. Put it in my tray. I'm done with the lubricant. I'm going to get my catheter. Take the sleeve off. Done with it. I'm going to get the lubricant on the end of the catheter. And I'm going to hook up the syringe. I'm also going to note that this is a 14 French catheter and it can hold 5 to 10 milliliters. I'll need that for my documentation later. Okay, now, got everything ready. I'm going to clean the meatus. So I'm going to grasp the foreskin. If it's hasn't been retracted yet, I'm going to retract it. I'm going to use the crane method. Coming in, I'm going to wipe in a circular motion once around the meatus, come out, throw away. I am going to use the crane method, come in again, go again around the meatus, throw away. And I'm going to go a third time, come in, come out, around the meatus, and throw away. So now, the meatus has been cleaned. I am going to insert the catheter. Careful not to touch the patient with it. And I am going to tell the patient to take a deep breath. And I'm going to insert the catheter with the penis having light traction on it. I'm going to insert the catheter up until I get to the bifurcation. Like so. Should see a little bit of urine come out. I'm going to stop there. I am going to inject somewhere between 5 to 10 milliliters. I'm going to go with about 7. Okay, I'm going to come here and disconnect. And I'm done with the syringe. So, catheter should be installed. I'm going to give a light tug on it. You can feel a little bit of tension on it, so that's good. The catheter has been installed, and now I'm done with the sterile procedure. I'm going to get rid of my gloves. Before I get rid of my gloves, I'm going to remove my sterile field. So that I can have room to take the tubing to the patient's leg. Now I'm going to get rid of my gloves as well. I'm going to perform hand hygiene. I'm going to put on clean gloves.
And what you want to do now is
my glove was tore, so I'm going to get new gloves.
what you want to do now.
Let me get the catheter out. I'm going to secure the catheter to the patient's leg so that it can't get tugged out.
You want to get under the lip of the third one.
And I'm going to hook the catheter to the side of the bed, down on the frame. All right, the procedure is complete. I'm going to clean my mess up, get this out of the patient's way. I'm going to cover the patient back up and make sure that they are comfortable.
Go in the middle of the top.
Ms. Jones, I want to thank you for being cooperative, and I'll be back to check on you later, see if you have any discomfort or if anything else is going on. I'm going to lower the bed to a safe height for the patient. I'm going to give the patient their call light. I'm going to make sure that they are comfortable. And before I leave, I'm going to check the room for any hazards and then I will be documenting my findings on my report, and I will note the size of the catheter and the amount of fluid that was inside.
Do that.
Before I leave the room, I will throw in my gloves and perform hand hygiene. Upon removing the catheter, I will okay. For catheter removal, I would knock on the door. I will introduce myself as the nurse. I will verify the patient's identification using name and birthday. I will check it with their wristband. I will double check the provider's orders to remove the catheter. I will ask the patient how they feel. If they're allergic to any medical supplies, latex, cleaning solution, they say they are not. I will tell them I'm going to be removing the catheter, and I am going to raise their bed to a proper working height at waist level. I'm going to perform hand hygiene.
And you want to make sure that you don't bring this in.
I'm going to put on
You just wanna
clean,
get a
non-sterile
little piece of
gloves.
it and then put it down there.
I'm going to ask the patient if I may expose them. They say that it's okay. I'm going to reveal the catheter. All right, so I'm going to untip from the leg, free the catheter up. I'm going to insert the syringe into the port. I'm going to draw out the documented amount of fluid.
Then on like the last piece, you just want to write your initials, the date.
You got your insert name here too?
So the next person who does the dressing can know, what time we use that.
Yep. Yep.
When the fluid's been removed, I'm going to tell the patient to breathe, and I'm going to pull it straight out. Catheter has been removed, and I would note the urine color and document if necessary, but other than that, throw it away. Catheter has been thrown away, properly disposed of. I would tell the patient thank you for cooperating, and I would cover them back up. I would make sure that they are comfortable. I would lower their bed to a proper safe distance and tell them thank you. I would make sure they have their call light, make sure they're comfortable, let them know I'll come back and check on them later. And I would remove my gloves to perform hand hygiene. I'd gather the trash and supplies that I brought in, and I would leave the room and document anything that was abnormal during the procedure.